Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and here's my roundup of the week's key issues in relation to the COVID-19 pandemic. The week began with the 8th of June, the date on which dental practices in England were allowed to start once again opening their doors to face-to-face care. As reported previously, we estimated that roughly a third of English dental practices were in a position to do so on that day. This is going to increase, of course, across the coming weeks, but the fact remains that it won't be business as usual across the country, and patients are likely to find something of a skeleton service. As our chair, Mick Armstrong, was quoted in the Daily Telegraph this week, dentists may be reopening their doors, but the threat of financial collapse still looms large. You may have already seen that we sent an open letter to Matt Hancock, Health Secretary, calling for urgent support to keep practices afloat and to avert a collapse in patient care. We've requested immediate action to keep PPE supplies open and to provide clarity on key worker status, which has seen dentists and their teams unable to access childcare. We've also reiterated our call for financial support, including an extension of business rates relief. We'll of course keep you updated as things progress. As well as in the Telegraph, our message was repeated across the media this week with extensive broadcast coverage on Monday, and thanks to the wide range of dentists getting the message out there. There's a complete summary on the website of our press activity, so for those interested, I'll link it underneath the video today. Practices in Scotland are to be given a date from which they can resume face-to-face care after the Scottish Government's next review of lockdown regulations on the 18th of June. We know that it won't be a target date for everyone, as the CDO Tom Ferris has recognised that not all practices will be able to open right away. Meanwhile, in Wales, CDO Colette Bridgman issued a new standard operating procedure as part of the recovery for dentistry in Wales. The SOP covers protocols for aerosol generating procedures, and this comes in advance of the next phase of de-escalation in Wales, when from the 1st of July, all dentists can offer a greater scope of treatment for COVID-19 negative patients, including AGPs for urgent care. Urgent care centres in the community service will continue to operate past the 1st of July to provide urgent care for COVID-19 positive patients until further notice. We've raised our concerns about private dentistry in Northern Ireland again this week. Practices relying on private income have been left in really dire straits, whereby no financial support has been offered, yet they're subject to the same practicing restrictions as other practices. As a result, many have reported that they're on the brink of collapse. We've sent letters to the Health and Economy Ministers and met with the acting CDO, Michael Donaldson, to urge him to relay the consequences of this situation upwards. We intend to offer some advice shortly, and we'll be keeping you updated as the situation evolves. You may recall that I've previously raised the tricky situation for associates in England who are in receipt of NHS earnings and yet might also be eligible under the government's Self-Employed Income Support Scheme, or SIS. We've been in contact with HMRC about this to clarify the situation, and they have. HMRC have now confirmed that if associates fulfil the criteria for the SIS scheme and they have seen a drop in their overall income, for example due to a reduction in private earnings, then they can make a claim under the SIS scheme while continuing to receive NHS payments. Access to the SIS scheme is limited to self-employed associates who earn less than £50,000 per annum. That's a point we've raised separately with the Treasury. For those who are eligible, the first claim must be made on or before the 13th of July 2020. We offer a lot more on this in our FAQ section on the website for associates. If it does affect you, please have a read of that. There'll be a link under this video. As a result of the pandemic, there's inevitably a lack of clinical training being offered in undergraduate and postgraduate dental education, and there's clearly a lot of concern as to how we support young dentists who are, for very good reasons, worried about their career progression. So we've written to the chair of the Committee of Postgraduate Deans and Directors, or COPDEND, to ask that we work together to provide the necessary support for the youngest, potentially most vulnerable groups within the dental profession. Our letter highlights the issues faced by dental students, graduates, foundation dentists and dentists in core and specialty training, as well as those undertaking PLVE. Finally, fit testing for masks is a big issue at the moment, and indemnity cover for fit testers has become a bit of a problem. We've raised that issue with various administrations, but are also pleased to confirm that our own indemnity cover does allow policyholders to fit test respiratory protective equipment for dental staff in their own practice and other practices. Plus, the practice owner's policy will cover an employee in their own practice to do fit testing. There's no extra premium payable to be a fit tester. Anyone undertaking training should be trained to the standards set by the British Safety Industry Federation and be accredited as a fit tester for RPE. We've more on RPE and fit testing and returning to face-to-face care in our toolkit. So if you haven't downloaded it yet, the link will be under this video. That's all from me this week. We'll continue to work on your behalf and keep you updated on all the major news and updates. Have a safe and healthy weekend.